So what's going on, everyone? I'm Rohan. I'm now a final year medical student at Cardiff University, which is completely crazy to say. So this video was made in reply to this comment over here on how to prepare for and how to manage the nerves of your OSCE examinations. So I did my OSCE exams like 2 years ago, so I'm pretty sure I have a very good depth of what it's like to do an OSCE exam and how much stress and struggles it can give to a medical student, and also all the anxiety that can come with it. Because medical school is a whirlwind. You get loads of information and you don't know what to learn, especially with an exam that's so broad. So just in case you didn't know, I actually have already made a video about OSCEs, but it was mainly to do with the resources that I used and not actually how to prepare for the OSCEs specifically. But I'm still going to put a link to that video in the description below, so if you have any more questions about that, then look at that video. It might help. In this video, I'm going to go over how to prepare for the OSCE exam and also how to settle the nerve before going into the OSCE station. Because I got a couple of tricks. Let's call it the tricks of the trade, shall we? So firstly, how to prepare. So in my previous videos, I briefly mentioned points about dividing and then subdividing your conditions into symptoms, signs, investigations, all that jazz. And I put a link down below to the exact templates which I used when I revised for my OSCE examinations. So have a look-sees at that one. So let's take stable angina, for example. So for those of you who don't know yet, stable angina, aka angina pectoris, causes chest pain due to poor blood supply. Stable angina, opposed to unstable angina, is basically this chest pain which occurs, but only occurs during exertion, as opposed to unstable angina which occurs at rest. So let's look at this example that I whipped up. So as you can see, I divided the things which happen to the person into symptoms and then the clinical signs, which is what you'll be able to see during an OSCE examination. You know, depending on whether they give you a real patient or a fake one, because in my OSCE exam, obviously the apocalypse was going on, so they only gave us patients who are A-OK. From symptoms and signs, now you need to know what investigations to use. Now it's important to show the examiners that you're thinking logically. Similar to how you would on a driving test, where you're constantly looking at mirrors and everything like that. In an OSCE exam, it's kind of similar. The examiner wants to know whether or not you've considered all the variables at each level. So starting with a simple bedside investigation, then bloods, then imaging, and then finally special tests. Now obviously some of these are not done by foundation doctors, but it's important to know because they can be referred to by foundation doctors to a more senior person. Plus it makes you stand out when examining the patient and when relaying your results back to the examiner. Then onto your management, and that can be divided into your initial management, onto your conservative management, which is often your lifestyle stuff, then to your medical, and then surgical management. Now that's basically how I revise for all of my OSCE stations, and I basically memorized the diagrams for each one. And I'm really good at memorizing colors, so I basically color coordinated all of these to the different parts of the body. And so for cardiology I made it red, for respiratory I made it blue, for gastro I made it green, and so on and so on. So when it came to answering the questions and giving my top differentials, I basically just recited my entire diagram. But the examiner doesn't know that. They just think you're really smart. And OSCEs, like anything else, is about repetition. So practice with your friends, your families, your colleagues, your housemates, but most importantly with your patients, because they're going to be the ones which have the symptoms that you want to be trying to find, and also the clinical signs which are going to be most important for an OSCE exam. Also, it's important to make yourself aware of the clinical signs which you see on patients, because signs, for example, murmurs, yeah, it's really easy to listen to it on YouTube and get accustomed to what it sounds like, but it sounds completely different to when it's on a patient. So make sure you see patients and learn what it sounds like in real life. So now on to how to handle the nerves. So the OSCEs are set up in a hall, kind of like your MMI interviews. Each hall has, let's say, 10 stations, and they're all set up like cubicles. And you go around clockwise in a group, and you go into the cubicle one at a time, each with different stations, ranging from histories, examinations, and so on and so on. In front of the door of every station is a brief, which is basically a brief explanation of what you need to do and what the station is about. For example, you're a doctor, please take a history from this patient who has chest pain. Now they give you 2 to 3 minutes beforehand to read the brief, and 2 to 3 minutes can feel like a lifetime, especially when you're nervous before an OSCE. So this is what I did beforehand, and this is taken straight from my mental health in medical school video. So if you have any more questions or just want to learn more about how to manage your mental health in medical school, then go over and look at that video. I must say it is top quality. So number 1, read the brief. Now I mean read it properly. So to calm myself down, I know this may sound counterintuitive, I didn't read the brief once, but I read it twice. The first time I read the brief, I tried to pick out the key words from the sentences just to make myself aware of the passage. And then the second time I read it a bit more slowly and actually took it all in. I knew that I was going to miss out something initially because I was nervous. And don't get me wrong, I'm not going to say I wasn't nervous. I was bricking it. So I did this method so I wouldn't miss out on anything to calm myself down. The second tip is that I closed my eyes. So after reading each brief, I always close my eye and just take 10 deep breaths in and out my nose. for 10 seconds. This relaxed the hell out of me. I guess you could say I was kind of in a meditative state of mindfulness and all that jazz, but once again, I was in an exam, I was in a room full of other people and I could hear everything, so I'm not sure. But all I know is that it relaxed me and it may work for you as well. I would also think of questions beforehand. So the hardest part of anything is starting. OSCE exams are no different. The start is always the hardest thing to figure out. Obviously, you say, hi, my name is blah, blah, blah. Can I please get your name and date of birth? Blah, blah, blah. But what about after that? So after I read the brief and get to terms of what I'm doing, I make as many questions in my head as possible to get the ball rolling initially. And then hopefully everything else will go to plan. And the most important one, practice, practice, practice. It's easier said than done, but with proper and excessive practice comes confidence. Then you're all Gucci. Once again, thank you for watching. I hope this helped. If you have any more questions about medical school, then hit me up in the comments below. If you want to figure out what I'll be doing every single day, then head over to my TikTok because I basically post it every single day. Once again, thank you for watching. Let's go.